Yes, ma'am. Sorry.
Just real quick, you mentioned education quickly, and obviously you're spending a lot of money on education. But when you come down to the local level, that is the one area that we spend the most money on. So there's a couple things that I'd just like to bring up as a possibility. One of the things that happens now is that there are many children, because of many circumstances, that aren't ready for kindergarten. Right now, there's a law that has been created that says children start school, they don't have to be 5, for example, until January 1st. You talk to people that are in the education profession, that gap when children are 4 years old to 5 years old makes a huge difference. Moving that date back to October 1st or September 1st would be a huge benefit to the cities. The reason being, now the children will be older, we don't have to spend the money to get them ready. They're going to have an extra year at home where hopefully the parents, and we all know that's another whole situation to talk about, all right, might be able to educate their children a little bit more or get them into programs where they can be educated. Bristol does a great job with preschool education. I know that's something that they're talking about. We don't have all day, it's kindergarten. So I think that's critical to Bristol that they start later. And that's something, I know there's a Senate bill that's before you now that's talking about that. And there are some reasons not to do it. But in the overall, this is something easy to do that would benefit the towns and cities that wouldn't cost you anything. Not a dime. Just move the date back and that will help us. The second thing is that in Bristol, for example, we spend 25% of our education budget on special education. Now, I'm not here to argue about special education. Anyone that has a problem certainly deserves all the monies they can get and all the support they can get. However, there are rules, and some of us know these, some of us don't. If someone is moved into our town from another town, for example, there's someone that has moved into our community that now costs the city $168,000 to educate one person, okay? God bless that person. I mean, I'm sorry that they're in this predicament. But because they moved to Bristol from wherever they came from, we are now responsible for that. That has to be addressed somehow, okay? Because the towns can absorb that type of money. There's no way that we can set that much money aside. And as I said when I started, my initial point was that this is the largest percentage of monies that we spend is on education.
Yeah,
so when the point was brought up that we don't throw money at education, we all agree with that. But if there are things that can be done that can simplify the situation and help and aid the towns, I think those need to be looked at.
Dave, I wish I met you years ago. I put in, for a number of years in a row, a bill to move the kindergarten start date back. September 1st was the date I picked, but I have 3 kids. My middle child was born October 18th, so we had a decision to make. But I don't know if there's more than 3 or 4 states that have what we have in Connecticut, which is to allow you to decide which grade your child would go to up to December 31st. And based on all of what we've learned in the recent past about the incredible importance of early childhood learning, when you put your kid in kindergarten, there can be as much as like 14, 16-month difference in age in kids. That impacts learning of kids at an early age. So
It certainly impacts the teaching of those kids also. So now you're spending more time with those kids than you are with the kids that are ready to go.
I'm one who would vote for that. I don't know if we have enough votes. I just wish you were there when we had the public hearing.
Oh, I'm sorry.
No, I didn't know you, so it's my fault.
Are you on the
Forgive
education
me
in
if you
Bristol?
spoke,
I used to.
when you were speaking, you were saying you were putting money into the nonprofits.
Yeah.
You guys have been around capital long enough to recognize
Mills,
the
yeah.
Ribbon,
I thought it-
Pins,
yeah, that was-
the Promise Coalition. Do you know what they are founded on? Okay. 11 years ago, when they proposed to close all the state mental health hospitals, that money was promised to go back into community supports. And instead of the money going into the nonprofits and the community supports, the governor went and put it into the general fund, and it was never seen from again, hence the Keep the Promise Coalition. I agree with you on the cost of a review. I actually was at a DCF presentation the other day, and I mean, people are actually hungry and begging to get the kids into Solent Hospital because it's appropriate, because it's medically necessary. And we can't close all the hospitals, folks, because there are some kids who are just that sick, who need to be inpatient and need that level of care. A lot of them can do in the support, but you know, so we need to provide appropriate services. And sometimes it is inpatient, it's not always. And then also, no kid wants to be stuck on, if you've ever been to this Bristol hospital psych floor, let's say, that's not for kids. Nobody wants to be stuck in those four walls, but if you're in a hospital that's an appropriate environment for children, they're more likely to do better. And as far as social services goes and oversight, House Bill 6367 with the budget, the governor is calling for the elimination of Behavioral Health Partnership Oversight Council. So if you want oversight for what's going on with the ASO that's got a $26 million contract, don't eliminate my council, because I'm appointed to that, and I've served with privilege for the last 2.5 years. And the BHPOC does good work, and we're nonpartisan.
Well, thank you for your service.
And you'll be getting my memo about mental illness 101. It's happening in May.
So Natalie, if I could just comment on what you said, one of the good news stories is we have what I would consider, I think all of us would consider to be an exceptional commissioner in the Department of Children and Youth Services. And Joanne Katz has done a remarkable job, and I talked to her and Commissioner Reamer. The collaboration between the two of them and dealing with mental health.
All three.
Yeah,
PSS, DCF, and
Right.
PMIS is what BHPOC oversees.
Did you guys get all those initials back there?
My whole life is acronyms. I'm sorry. When I'm an advocate for people excuse me, I am one. For people with mental illnesses and services and access to medications and supports.
But my point is that they are working hand in hand to deal on an inpatient basis with kids who clearly do need it. So there is a clear recognition that there is going to be facilities for that.
We can't just close them all down and save the money and put it, because there are some kids who just simply need that level of care, and it's not fair to them. But
And we've gone past the 8:30 time. Doesn't look like anyone's rushing in to expel us from the room yet, but.
thank you.
I think we just have time for a couple
Stay.
more
Let's see
questions.
if we can answer some more. Hold on 1 second, Matt. We'll get you. I just want to make sure that people who haven't asked questions yet, you and then you, sir. Again, first.
I'm a member of the Bristol Board of Education, and I want to address myself to that. But first, I want to thank you gentlemen for being here, and I want to thank all of you people for being here. You're the key to this whole thing. But at any rate, Bristol spends about $12,000 per student per year. There are communities, districts in Connecticut that spend $16,000, and their graduation rates aren't much better than ours. So there's not much value in that extra money that they spend. They get a few bells and whistles. We've been level funded for 4 years in a row, and we probably will be again this year, because the city is in crisis and the state is in crisis. Every year we lay off 2, 3, 4 teachers, staff members, paras, you name it. And Bristol does a darn good job. We're in the bottom 25% of what we spend per student and the upper 25% of our graduation rates. So say thank you to the teachers of this community.
Thank you. Yes, sir.